What is our attitude to older Australians? Do we not have enough respect for them?
Good morning, Laura. Thanks for having me on. I think generally that's true. I think we do live in a relatively ageist society. I think we've had a youth culture for a long time. And I agree with what Ian Yates is saying, that some of the things we see in the system, particularly people's access to healthcare and they're in residential aged care, is a little bit ageist. So I think that the act that's being proposed and taking a human rights-based approach is absolutely critical to getting the fundamental underpinnings of a new system right.
It's a big leap from attitude into this Royal Commission that detailed that 1 in 3 of those residents in aged care are receiving substandard care.
Look, I think we absolutely have to address that. There's obviously been instances where there's unacceptable care, and the Royal Commission has highlighted that. As providers, we accept and we stand ready to address that. We want to address that, and that's what we need to do. And that's where this report is really important, because it does talk about a complete overhaul of the system. It talks about resourcing the system properly, and I think if we do all of those things, we'll all be in a much better position to deliver the quality of care that we want, that older people deserve, and that the community expects.
Of all the providers that you represent, is every one of them failing on some level or another?
I don't think that they're failing. I think what they're struggling to deliver the quality of care that they want to deliver in a system that is in crisis and that has many systemic issues that need to be addressed. I think they try each and every day to do the best they can with the resources that they have. And as I said, we know that there have been instances of care which are unacceptable, and we want to fix those. But I think you have to look at systemic issues that we have that now need to have an opportunity to be addressed, and it's an opportunity we can't afford to let go as a country.
But 1 in 3 residents getting substandard care, I mean, I don't know whether that's emblematic or representative of the care across the services that you represent, but what happens in the meantime? What changes now? Do we expect that for 5 years that elderly people are just going to have to put up with waiting for days to be showered, waiting for their food to be delivered, and sometimes it doesn't turn up?
No, I don't think anyone's suggesting that we need to wait, but we do need to look at all of the reforms and look at how we implement them in a way that is sustainable. We need to look at the resourcing of the system. What we need to be able to do is employ more staff. We want to be able to pay them better, and we know that that's what our residents are saying they want, and that's what families need. We have to look at the resourcing of the system to do that. We currently have 64% of all residential facilities operating at a loss, and it gets up to 78% of facilities in rural and remote Australia. Right. So the Royal Commission has highlighted that the sector needs to be better resourced to do this, and that's what we need to see happen.
Do you need the government to move before you can?
On some of the recommendations, most definitely. So in terms of resourcing of the system, in terms of the system design and the legislation, we need to see how the government's going to respond. They did a start on Monday. They made a start, but they indicated that they would put in place a more significant response. And yes, for those really big systemic issues, that's absolutely important. But what we will do is
there's a simple one here, and one that you would have known about, and we represent not-for-profit centres, so we need to point that out, that, you know, this is not a profitable sector that you are representing. But, you know, staffing problems, ratios to aged care residents, can that be fixed straight away, or do you need to wait for
Not government? If we can't fix it if we can't employ more staff, and we can't employ more staff if the resourcing of the system isn't right.
So it comes down to money.
We desperately want to employ more staff. Some things do. I mean, I think you've talked about really important underpinnings and principles like the Act, which we fully support. There are things we're going to do around governance. But actually, for us to employ more staff, it is pretty simple. With 64% operating at a loss and 78% in rural and remote, we can't employ those staff if the resourcing's not there to allow us to do that.
Yeah, what happens with these staff? Because, I mean, you can't just pull them out of nowhere. They need to be trained. So where do we get these extra staff from? And I imagine we need thousands of them.
Yeah, look, by 2050, we need to triple the workforce. So in some ways, this is an opportunity, because we do need people to come and work in aged care, and people who work in aged care are very dedicated. They like working with older people, and they find it really rewarding. And I think more people need to think about it as a career, despite, you know, what they've probably seen. When you talk to aged care workers, they're very passionate about what they do. So there are great opportunities there. So we do need to be able to recruit and retain staff, and with levels of unemployment and people who've been misplaced, we would hope that people would consider aged care. And we need to talk about the opportunities that are there. You can do a whole range of things in aged care. We focus on nurses and carers who are absolutely critical, but you can also be in hospitality. You can also be in IT. There are lots of opportunities in aged care for people who want to work in a really rewarding career and work with older people.
What changes are your centres making as we speak?
So there has been a program of reforms around things like the Serious Incident Response Scheme. They're working on their quality standards, making sure that they're delivering the best care possible, looking closely at the recommendations around governance. There are specific recommendations around clinical governance and around governance generally. So working through all of that, we provide support to them through education and training and services to try and make sure that it's the best it can be.